The next thing we're going to be talking about is what I like to call age-related changes. Now, you may have heard of the term degenerative changes, and you may have been diagnosed with that. Again, these are one of those terms I'd like to just throw out of our medical community. More and more people are starting to come around to using the term age-related changes because it happens to everybody as you age. And so if you're 50 years old and you hear that you have degenerative changes of your back, you're normal. But you might have pain right now, and so that's why you're here, and hopefully this will help you. And so we're going to be doing some exercises that will help facilitate your circulation and address some of these issues that happen as we age. I'm going to have you exercise on the carpet at home if you have it, or a rug, just to have something a little bit softer as you lie down on. We're going to use a mat just because it's easier to show you the exercise. We're going to go over some exercises pertaining to the age-related changes that we all go through. And so you can see that we're on a mat here. You can be on the carpet at home, but if you're more comfortable with a pillow underneath your head, then that would be just great. We're going to start with the pelvic tilt, and this is an exercise that's useful in a lot of different conditions, and you may have seen it before. But Darren, I'm going to have you just tighten up those abdominal muscles and get that pelvis rolling back. It's okay to use the hamstrings and the glutes a little bit with this because we want to achieve a good amount of motion with that. Now, on the other hand, we don't want to lift up, so we want to keep those hips on the floor while you're doing it. So as he's tightening up those hamstring muscles, it's going to help his pelvis move a little bit more. The whole purpose of this is to increase circulation and blood flow. So you're getting more nutrients and more oxygen to the tissue that needs it. If you are waking up in the morning and you're just very stiff in that low back and it feels like it takes you several steps to get going, this is a great one to wake up to. And you can do it in bed if you just feel like you're having a hard time getting out of bed. And so tighten those abdominal muscles up. Try to get some movement back there, and as that moves back and forth, you're going to start getting some circulation and blood flow there that's going to loosen things up before you even get out of bed. Let's move to the next exercise. I'll have you grab around your knee, and let's just pull that hip up again. And again, with this one, we want to do the same thing. We want to get that pelvis to rock back with you. So as you pull that back, you can bring it a little bit to the side, and that'll give you a little bit better motion at your hip and allow that pelvis to rock back. This one I'm going to have be about 15 seconds, and then I'm going to have you switch to the other leg. And so about a 15-second stretch on each side, and then that'll just give that side a break and allow the other side to rock up. And again, the purpose of this is to get some range of motion and some circulation to the joints that need it. A lot of people find that they've done this already because it just feels good. So again, about 15 seconds each on those. And while he's doing that a few times, I want to talk to you about some of the other considerations for this. You don't want to lift a lot if you're having these symptoms, because as you lift, that weight is transferred through your spine and you're going to compress the joints a little bit more. So try to, in most cases, restrict your lifting to 20 pounds or less, unless you've been told by your doctor or your physical therapist that it should even be lower. But remember, that weight is transferred through the spine. The other thing is you have to keep that weight close to your spine. As you bring that away from your body, exponentially that increases the loading on your low back. And so you want to keep anything that you're lifting close to your body. If you could imagine, one of the worst activities you would do would be scooping snow, where you're bending forward and lifting and twisting. So if you can push the snow, that's better, or hire it out. The other part of this is aerobic exercise, because that gets your heart rate up. So as your blood gets pumping, that's going to get more nutrition circulating through your body. The low back is part of that. The goal ultimately would be about 45 minutes of aerobic exercise 5 days a week. Now, you may not be at a point where you can just do that, and you may be better off talking to somebody about what your best option is. Swimming is great, but again, difficult for a lot of people to do. Walking is probably the easiest one to do, but some people have pain when they walk, and so you need to find something that you can do that gets your heart rate up. If it's doing some squats or some simple exercises on your feet, preferably, to get that heart rate up, that's what I would recommend.